All right, so still continuing to look at some disease conditions and how they can actually affect pregnant women. And the next disease condition which we'll be looking at is what is known as Ebola. So everybody here might have known Ebola. It's a disease that at a time shook the whole world, you understand? Although it's more prevalent in Africa. So for Ebola virus, how could it actually affect a pregnant woman? All right, and to what extent? Looking at all those factors. So for Ebola virus, we said that if somebody has it in pregnancy, it's very serious, right? It's like a threat, This is because, a pregnant woman is, will I say she's more predisposed to being vulnerable because her immune system is not really that strong, So it requires specialized care, and this is because of a lot of complications that could come up. Right, so some complications might affect the baby, some might affect the mother. So what's the risk on the mother side? So on the mother side, we said that while pregnancy doesn't necessarily increase susceptibility to Ebola, it does heighten the risk of severe illness and adverse outcomes. You understand? So she can have complications like miscarriage, she can give birth to the baby and the baby is dead, or if she's bleeding, she bleeds more because Ebola as a virus disease kind of like breaks down red blood cells, you understand? So Ebola virus can cross the placenta, and the viral RNA has been found in amniotic fluid, so that means it can actually cross to the baby. All right, also in placental tissue, also in breast milk. All right, even after the mother recovers, you understand? So okay, so what's the issues on the baby side? So on the baby side, most infants born to mothers with Ebola do not survive. Do you understand? So most of them, they die. So vertical transmission, so it actually moves from the mother to the baby. Okay, and Ebola RNA has been detected in fetal tissues. All right, so diagnosis and management is pregnant women should be prioritized for Ebola testing, mostly in what places where you are suspecting that you have the presence of this virus. So obstetric care must be integrated with what Ebola treatment protocols. All right, ideally in what specialized Ebola treatment centers. Experimental treatments and vaccines may be offered under the same conditions, all right, as for what you do to a person when they are not pregnant. Okay, so infection control, so health workers attending to a woman that has Ebola virus should be well equipped, wear the right clothing and all. Breastfeeding should be paused, okay, and modified because there's a risk of what the virus actually moving from the breast milk to the baby. All right, so that's it.